I personally think that women, as soon as they're ready to conceive, should just go out and do this. Similar to their partners should do a sperm test. I think it's just so common. Infertility is so common that the sooner that you can get some of these screening things done and into the doctor, if that's what it requires, the better. We call it like a pit of despair, where it's like, okay, I'm just going to use this free app that I got download on my phone. It's going to arbitrate. It uses the calendar. It tells me, this is my fertile window. They have intercourse during that window. They don't conceive, and they just get more frustrated and frustrated. Then when they go to the doctor, they're shelling out way more money because they're so frustrated and they're so depressed at their situation, that I would love, a couple $100 to get some screening done, see what your cards are holding, get to the doctor sooner, and kind of be more in control of the journey, I think has helped a lot of couples.
Clinton, you ready? You got good Wi-Fi?
I think it's better. I think it's
All
better.
right, check it out.
And
That's a nice painting. That's a nice painting you have in the back. Is that your
this is my
wife's
wife's
office?
office. Yeah.
It looks a little nicer than.
My wife's an a OBGYN, so this is more up her alley. I have to be honest, I know nothing about ovulation and
Uh,
female hormones, so I'm gonna sound like an idiot. I
at
think
least I
Dr.
read about it. I had to review some med school textbooks in the back just to remember what happens with estrogen and progesterone. Like just to remind myself.
So you're gonna have to educate us
She's a
like
PhD, so you don't look so
deeply
don't look too dumb.
all about ovulation. So, welcome back to Recommended Daily Dose. I am Dr. Clinton Coleman, along with the incomparable, impetuous, impregnable Dr. Suraj Saggar. So this
Impregnable.
impregnable, that's
Oh,
from
it's
Mike
good to be
Tyson.
back
Remember?
with you all.
Yes, yes, and it's relevant to what we're going to be talking
He
about. Get
used to
it?
say all kinds of
Impregnable.
funny words. You have to do it.
Yes.
You have to say it with a lisp, like good old Iron Mike used to say.
So this is a new one for us. It's all about ovulation and fertility. We have the wonderful Dr. Amy Beckley. She is a women's health expert and founder and CEO of Proov, the first and only FDA-cleared rapid test to confirm ovulation at home. So we're going to get into all the nitty-gritty. We're going to talk about her personal story, all about women's health, and figure out if we can spread the good word. Welcome to the show.
Thank you so much for having me.
Yeah, thanks for joining us from snowy Denver. So maybe you can just take a minute and a little background about how you came with this company, and I understand this is a very personal story for you. So maybe you can
Yeah,
start there.
absolutely. So very early in life, I loved the medical field. I was 16. I was diagnosed with a brain tumor. And I had a fantastic doctor who went above and beyond and said, hey, let's get this MRI. And just didn't say, oh, let's just give this teenager migraine meds. And so forever grateful for that opportunity. And I said, I want to be that doctor that goes the extra mile, that kind of, thinks, outside the box and tries to be like, I don't know, you guys remember House, that TV show, like
Yeah.
those kind of things. Anyways, I went to pre-med, and I got an EMT license, and I was training to be a paramedic. And one of the things I had to do was volunteer in an ER, and I had to hold the hand while they were giving stitches. I
Sure.
very quickly learned I do not do well with needles. So
But maybe a different career choice.
yes, different career choice. But I love science.
Yeah.
And so my roommate at the time got me a job at a tech company, and we started researching how drugs work. And I thought that was just amazing to just understand how everything worked, how a therapeutic could cure cancer, what it was doing, what the mechanism
Sure.
action. And so that's where my passion turned, was, science. And I was like, I can do my contribution to medical field, but by doing science. So I got my PhD in pharmacology, did a little breast cancer research, did a little vaccine research, and got married, got a house, got a dog, moved to a nice neighborhood, that whole nine. Next thing was
Sounds
Yeah.
like
kids.
Dr. Saggar.
My dog, his name is Otis, and I love him.
Otis.
Just since it's Valentine's Day, I'm gonna go ahead and put it out there. I love my wife too, but we do love Otis. So
You love an
continue.
old black man dog named Otis.
He's from Tennessee, and that's the name he came with. And when we saw him, he looked like an Otis, and Well,
My
it was love at first
sister-in-law
sight.
has a
So,
dog
but
named Otis, but it's a girl dog.
Oh,
is that
that's
right?
interesting.
Yeah.
Oh, that's a
Mhm.
new one. Clinton, you want to
Yeah.
comment on that? That's a new one.
I have no
Well, she
quips for
had
that one.
him since she was such a little puppy, and she couldn't tell it was a boy dog. And
Oh,
so, or a girl dog, she thought it was a boy dog. And so she named it
oh, so
Otis.
she named it thinking it was a male, and
Yeah.
then
Yeah.
Sorry, we got
well, this
sidetracked.
is the
Sorry.
You
Yeah.
were saying, yeah.
that's funny. We get sidetracked a lot in the show.
Yeah. So we decided to try for a family. It did not come easy. Instead, I kept having miscarriages. I got all the testing done. I was unexplained infertile, told that, IVF was my only option. Did that, have a son after my second round of IVF. His name is Cash. We tease him because he took all of our cash.
Cash.
IVF is not cheap.
Yeah.
It's probably all in $45,000. And then when I went to have my second child, I said, you know what? I'm a scientist. For a living, I can try to figure out what's wrong with me. And so I went back into my doctor, reproductive endocrinologist living in North Carolina at the time. And I said, all right, dude, you talk medicine. I'll talk science. Let's have conversations. Let's figure out what we're missing, because I kept getting pregnant. I kept losing the pregnancy and something was going undiagnosed. And so we focused on this idea of ovulation, where typically people think of ovulation as just the release of an egg. The egg gets fertilized, you get pregnant. Obviously I was releasing the egg, I was timing intercourse correctly, we were getting pregnant, but I kept losing the pregnancy.
Right.
And so if you look back in the books, right, ovulation is more than just the release of an egg. It's also preparing the body and the uterus for implantation and pregnancy.
Sure.
And so I said, all right, so we know that I'm getting pregnant. We know that I'm not staying pregnant. What are the hormones involved in, preparing the uterus for pregnancy? And it was estrogen in the first half, which creates a nice thick lining so that it can be a nice bed for the embryo.
Yeah.
But then the second hormone was progesterone. And so progesterone is what makes it receptive, makes it sticky so that it implants and it thrives that entire 9 months. And I said, well, I have a lot of spotting in my period, my luteal phase, so the time from when my ovulation test turns positive to when my next cycle started was very short. Could I have a progesterone deficiency? As part of IVF, I'm given progesterone. They're very, very nice shots right in the keister. Very not very pleasant. So I remember them quite well. Can I just have the progesterone to conceive naturally, have the progesterone support after? And it was like, well, sure. I mean, it's a natural hormone. We do it through IVF. I don't know if it's going to work, but we can try it. And that solved my issue. And so I have a 9-year-old. We call her my progesterone miracle. And the whole thing that we were missing was a single blood test would tell me, yes, you did ovulate, you did release the egg, but it wasn't confirming that I had that sustained level of progesterone, saying that I had a good ovulation. Not only did I release the egg, but that my uterus was this nice environment for implantation.
It was receptive for maintaining a pregnancy.
Exactly.
I want to ask one question because it was very helpful for you to just describe that. I mean, it's not only medical listeners that we have, but we have, general public, but certainly us. But then, of course, one would ask the question, before IVF, would they just test someone for progesterone levels? And I think you're saying that no, it's not routine.
Well, they did, and it's non-diagnostic. So basically, I had a progesterone draw, and it showed that I had adequate levels. But what was happening? It was dropping too soon. So if you think about your cycle and ovulation, when you fertilize the egg, it has to go all the way through the fallopian tube to the uterus to implant.
Right.
And if there's not enough time to make that journey and your hormones drop too soon, that starts the new cycle. Your uterine lining starts to slough off and you get your next cycle. Yeah. So practically speaking, you can do it one time in a blood draw. And so what we do, what I invented was a urine-based test where you could do it 4 days in a row and you can look at sustained elevated levels throughout this implantation window to say, was it a healthy ovulation? Do you have levels that remain high?
So how does that differ from what, I know there's different methodologies people look at in terms of just getting pregnant. Of course, you're talking about not just getting pregnant, but sustaining. but can you just go over the science of, temperature, cervical mucosal thickening, whatever, how does that differ from what is available currently on the market, or methodologies that people use when they're trying to get pregnant?
Yeah. So, I mean, I did all those things. So I was tracking my temperature.
Right.
And I almost felt like it was a disservice to me because, again, people think ovulation is a yes or no.
Right.
Right. And so cervical mucus is what happens when you have a mature follicle and you have a lot of estrogen, tells you you're fertile. That helps the sperm survive in the reproductive tract for a long period of time. So it tells you when you're fertile, when you should have intercourse. The temperature shift. So after you do ovulate, you release progesterone, which causes a little bit of a thermal shift in your temperature where you can track that and say, yes, I have ovulated. And so I would go to the doctor and say, oh yeah, I've ovulated. And they do the progesterone draw. Oh yeah, you ovulated. But not all ovulation is created equal, right? It's just like not all eggs are good eggs. You have, poor egg quality. You can have poor ovulation quality, right? And so it's really, it's one of those things where we can't just say yes or no. It's like sperm. Yes, it takes just one, but if you have a low count or if you have a non-modal count, you have a less chance of conception. Well, if you don't have sustained elevated progesterone levels after ovulation, you have a lesser chance of pregnancy. We actually did a clinical study last year that shows that it's an 8-fold increase in pregnancy rates when you have that sustained elevated progesterone levels. And if they're not elevated and you do get pregnant, it's almost a 90% miscarriage rate.
Wow. So is there any utility to using like the ovulation calendars and the apps and calculators and stuff?
Okay. Yeah, it's absolutely. It's for timing intercourse. So you can, that is for fertilization, which absolutely is important. We're talking more about, okay,
maintaining, sustaining a successful implant and then carrying it through, right?
Yes.
Yeah.
No, it's an addition to. Yeah.
And so now, so you're saying they may draw a bracelet. Someone may go to a reproductive endocrinologist, and even before IVF, they may get a progesterone level initially and say, well, it's adequate. But then they're not necessarily looking at progesterone levels across a cross-section of time. Is that right?
Correct. Uh-huh.
But I think what she's saying, or correct me if I'm wrong, is that once you're fertilized and you have this test, you can then increase your chances of preventing a miscarriage by ascertaining, okay, after implantation or shortly after fertilization, progesterone levels drop. And then these would be people that would benefit from progesterone injections. Is that right?
Yeah, that or ovulation induction. So medications like Coleman and letrozole that induce a stronger ovulation.
I see.
Yeah. So, I mean, basically what it is it figures out if you have an issue with ovulation, because problems with ovulation are the leading cause of infertility.
Right.
And so we're just helping define what that issue is. Are they not ovulating at all? Was it kind of a weak ovulation? Will they benefit from ovulation induction medications? And then you can use this to say, are the medications working, or do we need to change your dosages?
Do those ovulation medication inducing medications then command a stronger progesterone response? Is that right?
Yeah, that's right.
Yeah. Okay.
Yeah. I mean, like one of the biggest user bases we have, we have 2 user bases. One of them is women with PCOS or polycystic ovarian syndrome. Basically, they have a dysregulation in their hormones, and their brains and their ovaries are pumping out hormone, and their ovaries are just like, I don't know what to do. Right. It's like when, people are screaming at you all the time, you kind of shut your ears off. You're like,
it's like when Clinton talks to me sometimes, I shut
all the time.
I understand.
Right. And so they'll ovulate, they'll release the egg, but it's not a very high progesterone producing ovulation, and they have issues. And so they say, okay, well, let's help you induce a stronger ovulation. Let's give you some letrozole, which is Femara. It's the generic of Femara, early in the cycle. And what that does is it blocks endogenous estrogen. So it helps quiet the ovaries, and then it can help stimulate the body to ovulate.
Is there any benefit for women who don't have fertility issues to actually, find the optimal time when they're ovulating for, I guess, the most beneficial part of pregnancy? Or is this mostly for people who have trouble conceiving?
We think it's a screening tool. I personally think that women, as soon as they're ready to conceive, should just go out and do this. similar to their partner should do a sperm test. I think it's just so common. Infertility is so common that the sooner that you can get some of these screening things done and into the doctor, if that's what it requires, the better. We call it like a pit of despair, where it's like, okay, I'm just going to use this free app that I got downloaded on my phone. It's going to arbitrate. It uses the calendar. It tells me, this is my fertile window. They have intercourse during that window. They don't conceive, and they just get more frustrated and frustrated. Then when they go to the doctor, they're shelling out way more money because they're so frustrated and they're so depressed at their situation, that I would love, a couple $100 to get some screening done, see what your cards are holding, get to the doctor sooner, and kind of be more in control of the journey, I think has helped a lot of couples.
So is this obviously making this test, and so you said it's a urine-based test at home. And I was reading, you can order it on Amazon. Is that right?
Yep. Mm-hmm.
You're on Amazon. So you're basically taking this technology and making it widely accessible to the masses. Is this something that that a reproductive endocrinologist or a reproductive OBGYN or what have you may do? But the idea is that this is able to be done, make it more accessible to more people that don't always have access to healthcare, or I'm assuming it's a much more cost-effective way, right? As opposed to either waiting all that time and then finally saying, resigning yourself, yes, I need to go see an IVF or fertility specialist, what have you.
Yeah, no, I mean, like, there's arbitrary time limits on things. So, when I was going through it back in 2008, it was, you have to be trying 12 months and you've had to have had 3 or more miscarriages.
Right.
So, I mean, that's insane, right? So, our idea is to get her in the door to get that further diagnosis by the physician. And a lot of times, the medications that solve ovulation issues can be prescribed by OBGYNs. 50% of the OBGYNs we talk to say they prescribe these medications regularly. Right. There's a really good chance that you don't need an RE, and a regular OB that's covered under your health insurance with a $10 copay medication after you bought a $30 test kit on Amazon, which is a way better solution than waiting years and then, emptying your savings account into an IVF procedure.
So well, first of all, congratulations on success. I mean, you've been written up in a lot of major publications. You're on Amazon. I was reading even Target. Is that right? Or Target Online? Or is that you're looking at it as well? Or once you're on Amazon, it doesn't matter. You're accessible to everybody.
Well, if this episode airs in March, we will be at Target. Yes.
Target, yay!
Target. We like to call it Target. It's a little bit more fancy. And
so, have you gotten any feedback, like personal stories that?
Oh, absolutely. Yeah. I mean, people are just so thankful that this is accessible. They feel like they're not heard. Because it's like standard healthcare is you're not defined as infertile until 12 months.
So, right.
It's like women are like, I don't want to wait that long. Right. My clock's ticking. I would rather, so just enabling them to kind of have that information and start that conversation sooner has been life-changing for so many couples we talked to.
I think I was reading on maybe it was an article about you in Forbes, or I think somewhere else, but you were saying that some of these arbitrary timelines, jokingly, I think you said, must have been invented by men, right? Because
of course,
it's easy for them to say, well, wait until this amount of time, but then all the emotional and physical and just social devastation, trauma, right?
Well, I mean, they've done studies.
Or wait for 3 miscarriages. I mean, that's devastating. One miscarriage is devastating. So
yeah, I mean,
it does seem very arbitrary. I mean, I'm sure it's based on statistics and things like that.
But no, it's probably based on epidemiology and cost savings versus.
Was there some of that as well? Sure.
Yeah, I mean, they're doing some studies where 87% of women who are infertile have depression, and they've had suicidal thoughts. And like, miscarriage is devastating. Like, you take cancer diagnosis and you put infertility diagnosis, they're like head to head as how extreme it is, and so anything we can do to, just have that earlier screening. I say you might be a healthy person, but if you take a test and you show your A1C is elevated and you take that to your doctor, they're not going to be like, yeah, I'm sorry, you haven't had diabetes long enough. We're going to wait a little while. Right. And so it's just having the right information to say, hey, I haven't been trying that long, but I have this that it could be an issue. Can we like do some additional testing? Can we figure this out? So it's just about, in starting that conversation and providing tools to help couples conceive.
I wanted to ask was, so you're taking from a business point of view, or you found this deficit in medicine and came up with this great business idea that obviously is able to help a lot of people. One of the hats I wear is I'm involved with a lot of clinical research at our institution. So how do you validate a test like that? Or can you just talk us through just very broadly how you take a concept, an idea, and then bring it to market? And then what are the basics of being in medicine and science, that how you get this validated and then accepted is, so this is not Clinton takes all this kind of stuff as seen on TV to have that nice hair, but this is just stuff that people are putting out in the market. Like you're talking something and partnering with other physicians and OBGYNs and things. So I'm just fascinated how that would have come from an idea and then come to market, and then what was that process along the way?
Yeah, I mean, it's very interesting. I'm just a scientist. I don't know anybody famous. I'm not a doctor. And I just had this issue, and I said, what would be so cool if we had an at-home test that could do this screening? And so myself and another woman who also did IVF to conceive her son started a crowdfunding campaign. We went on Upwork. We got a $50 logo. We put this idea together. We ordered some reagents online. I did proof of concept stuff in my basement, and we just put it online. We're like, hey, this is our idea. If you think it's a good idea, buy it, and then we'll make it. And
right.
that was just basically the premise.
Wow.
And so we did. Like we got funded within 48 hours. And was got all the money.
And this funding is just through like crowdfunding, just literally private investors and through.
No, it wasn't even equity. It was Indiegogo was the platform. So it's like Kickstarter, but a small note, you cannot make a medical device on Kickstarter, but you can Indiegogo.
That's good to know. Yeah.
But yeah, we would pre-sell the test. We say, donate to our campaign, and in return, we'll give you the first tests that come off the line. We got 287 backers within 48 hours. We got enough money to do our prototypes. And then being a scientist, I was like, what can we do with these women who want this tech? Started an IRB and just, said, hey, this is optional if you want to be included in the IRB. We got enough participants from those backers to do the study, and we did all the validation work with them. We went through a couple different prototypes just to make sure that it was a good product.
Did you partner with a lab in the area? I mean, is this all in the basement, or did you partner with a lab or a biotech company or your own company or with?
Yeah, no, that part was not in my basement.
I figured that.
Yeah, we use a contract manufacturer.
She grew outside the basement.
FDA registered CGMP. So like basically what we did is we went on FDA.gov and we're like, what do you need to do to make a medical device? And we just read the rules, right? You read the regulations. What do you have to do? And we just followed it. And so we didn't have FDA registration, CGMPs, whatever. And so we found some, and then we paid them to make it.
A contract organization, right? Yeah. And then, but you had to sell the idea, right? And that went well. That obviously went well. But how do you prepare for that? Do you go to the CMO, contract manufacturing organization, and say, "Look, we have this idea, and would you like to partner?"
They're just a vendor.
Or they're just happy, they will just do it. They're a vendor. Yeah, they'll do it regardless.
This is what I need to make. Here's what you need to do. How much is it going to cost? And then, I mean, we talked to a bunch of people, and then we found one and made it.
Have there been any studies comparing fertility rates, or I guess conception rates, with the traditional method versus this new method?
Yeah, we've done a few studies. The first study we did was comparing it to a progesterone blood draw, just to say that, yes, we can confirm ovulation with urine.
Yes.
So did that was fine. And then we did it conjunction with like a fertility test, like a Clear Blue ovulation test. We would show that it's negative, and then you get your clear blue, peak fertility, ovulation time, and then our test turned positive. How many days after that did it turn positive? So we show that yes, progesterone's only going up after ovulation. And then we did a study with looking at the PDG levels, which is this progesterone metabolite in urine, over the implantation window. And if it was a negative cycle, what's the pregnancy rate? If it's a positive cycle, what's the pregnancy rate? The pregnancy rate in a negative cycle, so when PDG levels were low below this certain threshold, it was only 14%. But then PhD levels were high, that pregnancy rate jumped up to like 89%. And so there's a huge increase of pregnancy chances when you have high PDG after a positive ovulation test result or a positive LH surge. That was kind of our Gen 1 was just doing that one product. That was back in 2017 that we launched it. We just recently last year came out with a new product called Complete. And it monitors all the hormones across the entire cycle to give a complete picture of the cycle. So we do everything from getting an ovarian reserve, quick screening for PCOS, find the full fertile window. So we see that rise in estrogen to open the window, and then we see the rise in progesterone to close the fertile window. Then we look at the luteal phase health and say, okay, was it a successful ovulation? Do you have sustained progesterone after ovulation? And we put it all together in a nice report. And that helps women flag issues to their physicians and say, hey, maybe my ovarian reserve is getting low. Let's talk about this. Maybe I'm not timing intercourse correctly, or maybe I have an ovulation issue. And so it's like the most common causes of infertility in a woman packed in one kit. It's under $100, where it's just, let's knock them out. Let's figure out, a quick screening method to get her to that doctor if she needs help.
Yeah, I think women's health is such a natural vector for patient empowerment that it's amazing that the products like this are available. It's also sad that it's been so long and so many people had to suffer
that's what I was
trying to go through this stuff.
It's almost like you can't believe that something like this,
right,
the idea not existed before.
Well, yeah. So that's the funny story is I figured out with my daughter that it was a progesterone issue and I needed a better ovulation to have her. And then I started thinking, well, we just make an at-home progesterone test. Like, why has that not been invented before? And so I went in and, being a researcher, looked at PubMed, looked at all the publications. And there was this one from 2013 that was like, yeah, and they validated this marker and like all this stuff. And they're like, all we have to do is make a home test, period. And so I emailed the author. I'm like, what is going on? Like, this was like 6 years ago. Where's this test? Like, what's going on? And they said it was a business decision to drop it because someone told them that women didn't need this information. I mean, it's different times, of course, but I was like, okay, well, and then so we formed the company, and the product is called Proov, but the company name is MFB Fertility, which is my fabulous basement. And it's like, ain't no one else going to do it. I'm going to go in my basement. I'm going to do it myself.
Amen.
That's a great story. And what is it basically being used for now? Now it's a nursery, or you're still making other things to come to market in years?
That's where my Peloton is.
Who's your favorite Peloton instructor?
Cody Rigsby, hands down.
Oh, that's hey.
I know people like him. I know he's a lot of fun, and I know Clinton likes him. He does the jazz hands workout.
Jazzercise, yes.
I like what's his name? Oh my God.
Toussaint.
He is. Exactly. And I like some of the other ones that do like some of them, like Dennis Morton as well.
I like Alex. His club banger ones are fun.
They're very good. Alex Toussaint. And he has these great sayings. I now I'm forgetting. I'm trying to think of all the sayings, but like all these.
You woke up. Time to celebrate.
All those like positive, but really strong positive sayings. That I like to say to myself in the mirror when I get up in the morning. Just
look at you. You're so inspired. It's
confirm my day. So what is the future of
wait, I have a question. What would happen if we measure Dr. Saggar's progesterone? Like, would it be will we find the optimal window for him? No.
I could use a little testosterone up here, I probably, just to keep that whatever hair I have left. But what is the future now? I mean, what are you've shown clearly that kind of like a homegrown idea can be taken from a proof of concept to market. Well, first let's start off with you're on Amazon. Where can people find you? I mean, your products as well as your presence on the internet and beyond.
Yeah, so the biggest resource is our website, ProovTest, PROOVTEST.com. Sign up for email. There's a bunch of blogs, lots of content. One of our pillars is education. We want to make sure that women have the education. We sell both female fertility and male fertility tests on our site. We think that women take most of the burden when male fertility is half the equation. And so we have a really cool hers and his screening kit. I think it's $159, but it covers all the bases, men and women, includes pregnancy tests. It's a really cool kind of like starter kit. We're on Amazon. We're on Amazon Prime. We realize when you want to test, sometimes you need to get it there quick. We are launching in
Prime can be dangerous. Prime can be dangerous. The amount of boxes that show up at our house every day.
Yeah,
I feel bad because I order one item at a time, and it's like every day I have some kind of box.
But that's wasteful. You should
bad.
say save them up and ship them as least amount of containers as possible, and you get yourself.
Do you know Colorado's solution to that? Every order you make, it's 27-cent handling fee. They're taxing each.
Oh, they're taxing me. It's an environmental tax to almost like.
Yeah, I guess what it is. So like if you forgot on your Amazon order, it's another 27 cents. You're like, ah.
Yeah.
That can add up though. That's the thing. It's for sure.
Yeah. It's like at the grocery store. Now it's 10 cents to have bags. And so you better not forget your bags.
I keep them in my car. Yeah.
Yeah.
So
I will walk out with my grapes and milk. I don't care.
To save 10 cents.
How dare you charge me?
Almost like with Amazon Prime, you need to be in big box stores, but you're saying Target in March. Is that right? Another.
Yeah.
So I think having physical space is probably very big. And then do you partner with any physicians or clinics or reproductive health clinics or things like that or is that something you're looking at or?
Yeah. So we have a lot of education on the clinical side. And so we reach out to OBs. We go to ACOG, which is
ACOG, that's what I was going to,
yeah, ASRM. We have a booth. We educate so that physicians have the information. So if their patient comes in with it, we also have handouts to give to patients to bring to their doctor to educate them about the test.
Yeah.
We also have virtual fertility clinics that we work with. So if they live in a rural part of town, if they work with a doctor who just refuses to, talk to them before 12 months or whatever, right. We have resources that can do virtual fertility care. So it's all about, providing the resources that not only get tested, but also lead into the actual treatment.
Amazing.
Well, that's fantastic. And I'll just close. Then
I feel so much smarter today than I did
that's right. Well,
yesterday. Wow.
But I will say that, we're on the East Coast. And I think sometimes you get assumed living in the big cities, the New York metro, in our example, you have this whole host of medical specialties, almost at your fingertips. I mean, everything is very close by. You have huge academic centers, but most of the United States is not like that. And I think we sometimes forget that access to healthcare, how that can be so limiting. And perfect example, someone said like 80% of all counties in the United States don't have an IUD doctor. We're here. Clinton is very lucky to have me, to call when he needs some help in the infectious disease world. But all kidding aside, I think what you're doing here is making this very elegant testing and powerful knowledge available to everyone. And it's a cliche, but knowledge is power, and we really thank you for coming on and explaining everything to us. Because it's a primer for us to kind of remember reproductive health. And but it's fascinating. And also just the idea of how this came from the basement to Amazon Prime and proof of concept and I'm sure very successful business model that will continue to have success is very inspiring. So thank you for sharing your story very much.
No, thanks for having me and let me share the story.
Thank you. So Clinton's going to take it home, but
I take it anywhere.
We'll look forward to checking you out online and supporting you in any way they can. So
yes, the website is Proov Test. So it's PROOV. I guess that's a play on ovulation, right?
It's progesterone ovulation.
Oh, so P-R-O.
Oh, I didn't pick that up the first time. So
PROOV test.com.